from the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
March 10th, I'm Alexis Delcid, and welcome to All Things Heart. Here's what we're talking about today. Did you start drinking more during the pandemic? Even that extra glass of wine a night can affect your heart. Just one glass of wine. Cardiologists explain a phenomenon called holiday heart. Also, today's heart health tip, the main difference between heart disease in men versus heart disease in women. And what do you do to unwind after a long day at work? We're going to give you a peek at some amazing heart work that our teammates have been pouring their heart and souls into, and where you can see it all. And as always, if you have a question or a comment, you can share those with us on our Facebook Live, our YouTube channel, or just email us at allthingsheart@kumc.edu. Now to the show. St. Paddy's Day is 1 week from today, and for many of us, spring break is also just around the corner. And often both spring break and St. Paddy's Day go hand in hand with drinking. So what does that have to do with your heart? Well, there's enough of a connection that cardiologists even have a name for it: holiday heart. Have you heard of holiday heart?
No, I have not. No, I haven't. No.
While holiday heart may not be a familiar term, a basic hangover has happened to the best of us.
Have you ever had too much to drink?
Yes.
Whether it's that one time in college or your best friend's wedding last month, most of us have overindulged at least once in our adult lives. And for many, once was enough.
Loss of equilibrium, inability to think straight, and inability to reason, loss of inhibition.
With drinking, it kind of slows down motivation a little bit. It makes you tired, makes you not want to be as active and stuff.
But avoiding alcohol altogether can be incredibly difficult, particularly around St. Paddy's Day and spring break in the Midwest, coming off 2 years of feeling isolated for so many people. Not to mention that references to drinking seem to be everywhere you look or click these days.
Oh, how it's wine o'clock somewhere, or, you just, everywhere I go, there's a t-shirt or a towel or a magnet or something with it on it.
About drinking.
About drinking.
I definitely think it's become so normalized drinking. There's everything you do is drinking, the paint and stuff, you know what I'm talking about? I don't know, I think it's become so normalized now, and social media probably plays a part into that for sure.
It's definitely a huge influence of, drinking and stuff.
But can 1 week or even one day of drinking more than usual really have an effect on your heart? Cardiologists say absolutely. Holiday heart is very real, manifesting with heart palpitations, a racing heart, and or shortness of breath. In fact, a recent study funded by the National Institute on Alcohol Abuse and Alcoholism shows just one glass of wine or beer or a cocktail can have an immediate effect on your heart rhythm, significantly increasing your chances of atrial fibrillation within just a couple of hours, even if you have no underlying history of heart disease.
Boy, that'll get your attention. And we have a stacked cast today. I'm thrilled to have cardiologist Dr. Rhea Pimentel here with us, along with addiction psychiatrist Dr. Rupa Sethi. And Dr. Sethi is also the medical director for the opioid treatment program here at the University of Kansas Health System. And we're also joined by cardio-oncologist Dr. Charlie Porter, who joins us virtually. I want to get to Dr. Pimentel first because, Doctor, we know you need to peel off a little bit earlier to see patients, so thank you for being so generous with your time. Now, holiday heart has another slightly less snappy name called alcohol-induced atrial arrhythmias. What is that in layman's terms?
Well, thanks for asking that question, Alexis, and it's great to be here today to talk about all of this. Holiday heart is what we as physicians refer to as when patients come in after a night or a day of binge drinking and they show up in a rhythm, particularly atrial fibrillation. The manifestations of this are everything you talked about: the fast heartbeats, the palpitations, the shortness of breath. But the good news is that it's typically self-limited, and we think it has something to do with the hangover part of drinking too much alcohol.
But this literally is just after one night of heavy drinking that you're seeing patients have to come see you. You're a clinical cardiac electrophysiology. That's your specialty. So you study these rhythm disorders. To be clear, are these people who already had heart problems or some sort of thing that put them at risk, or could this be anyone? This could happen to any of us tonight if we go out and have a rough night?
Sadly, this can happen to any of us, honestly. It's probably a little bit higher risk if you have a prior history, but really anybody, and we see this in the emergency room all the time. Patients who have no prior history of heart problems show up and they're in AFib, and then you find out that last night they had a good time with their friends, and that's probably the reason this all occurred.
I want to get to Dr. Sethi now, because Dr. Sethi, you're an addiction psychiatrist, so you treat people who are really battling addictions right now. Is this season, this time of year, particularly brutal? I would imagine this is a month when you are just surrounded by temptations and people drinking.
We do have a lot of patients come in and tell us that this is a month of triggers. Their cravings go up, and they are struggling with their alcohol. They do see us more frequently during this month. And based on this, we did some literature search to see if there were any articles related to St. Patrick's Day specifically and alcohol drinking. And we found that during this time, there was one study that talked about people's intent or students' intent was higher to drink. Their expectations were that their peers will drink more.
Right.
And when they looked at alcohol intoxication levels, they found that even that was higher. So the study specifically talked about educating the students because that could probably bring the rates down.
Are your patients students? I mean, I know you can't talk too specifically, but do you tend to see more young people who are at the college age, or are you seeing an older population when it comes to this?
That's a very good question. When I started here at KU, I was seeing more adults and older people, and now we are seeing more and more younger people come to us.
Wow.
And the clinic has actually expanded, our addiction treatment center has expanded, seeing more people who are younger and treating them.
I want to bring Dr. Porter into this because Dr. Porter, before the show, you and I had a long talk about the legal limit when it comes to driving drunk, which we know is incredibly dangerous. But then you also say there's another danger of people just drinking all day long and staying below the legal limit for driving, but that's still super dangerous for the heart.
Yes, it's really kind of been a process over decades of getting more aware of this, and I think the holiday heart, that was something where people first started seeing people. I would see someone who was at the Lake of the Ozarks on Saturday, and they're out in the boat all day, and they drink a lot more, and they end up in the evening, instead of watching fireworks, they're at Lake Regional Hospital with runaway heartbeats, and the research has expanded in that area, and now we can clearly see that there is the legal limit, which is 0.08 here. In other countries it's 0.02, and that's for immediate self-harm that day or hurting others. But there's a different kind of damage that's over time to yourself and to others around you that starts to show up clearly at a level of two drinks a day, which is 14 drinks in a week if you average that. And that's what's been characterized as heavy drinking, and there's a lot of different definitions, and the British use units and we use glasses of wine, and that depends on a lot of things. But one drink a day, that's kind of where the idea about ischemic heart disease and heart attacks being less common. And it's amazing, the heart attack risk does seem to be reduced with a very limited amount of alcohol, but many other forms of heart disease start out and never have a little dip, or what's called a J-shaped curve. They start going up pretty much when you exceed an average of 2 drinks a day. There's a small safety zone for ischemic heart disease. So I think that's the issue, is the chronic issues for your own health change earlier at much lower levels of alcohol intake than what you would metabolize too slowly if you've been drinking and be above the legal limit.
I want to bring in
safe driving.
Dr. Sethi has talked at length about the American Medical Association recommending what it calls its cutoff limits on drinking. So what does the AMA consider a standard size drink?
That's a good question, because a 5 ounces of wine is equivalent to 12 ounces of beer, is equivalent to 1.5 ounces of any hard liquor.
Just like a shot, 1.5,
yes.
right?
And I think a lot of people don't realize, because once you go to, say, a bar or a restaurant or somewhere to drink, it's not measured most of the times. And that glass could be a goblet, it could be a bigger one, you could get 1.5. And bringing that in for the American Medical Association also talks about, for women, no more than 3 drinks per day and no more than 7 per week. So if we have somebody who's drinking 3 on Monday, 3 on Tuesday, you're literally at that limit of about 7.
And I don't remember the last time. I know when you go to a restaurant or a bar, you'll get the typical 5 ounce pour. But when you're just pouring a glass of wine at home, it's more than 5 ounces, because 5 ounces just looks so small when you're pouring that glass of wine.
Yes.
So that's probably you're drinking 2 wines or 2 servings.
Yes.
Dr. Pimentel, does it matter how quickly you drink? I mean, is it truly the amount, or is it how fast people are drinking?
It's probably a combination, just because it's how quickly your body can metabolize the alcohol, and metabolism is different for different people. Some people have great livers and metabolize it quickly. Others, there are racial inequities. Asians don't typically metabolize their alcohol very quickly. So it's really a combination of the two.
There's a recent study out that listed the top 10 drunkest countries in the world. Now, we're not number 1 here in the U.S., but we are in the top 5. So I want to ask Dr. Porter, one, does this surprise you?
Well, nothing surprises me about anything anymore. But I think it does. I mean, it surprises me in the way they talk about this study, because part of this drunk is people who have reported to the emergency room because they're concerned about their alcohol intake. And that's one of the parameters that they use in Australia. And I don't know whether that's just they like to go to the emergency room more than they do, here. But, this is, if you look at this, these are 10 countries with fairly high socioeconomic profiles. And in studies, there are worldwide studies, and it shows that the alcohol related intake is higher in higher socioeconomic profile countries. So this is kind of in the right profile for what countries may see the greater signs of acute toxicity. Drunk is acute toxicity. Worldwide, they call it transport accidents. We call them car crashes. Right. But these things that occur the day you're drinking are what shows up in drunkenness, and that it seems plausible. That looks like a plausible list.
I want to ask Dr. Sethi about this, because this kind of piggybacks on my next question, which is, how have you noticed the past 2 years in the pandemic? How have you noticed that affecting how much people drink and what you're seeing in your practice?
Very good question, because when pandemic hit, a lot of appointments went telehealth. And before that, in our addiction treatment center, we would not get as much alcohol consults. But all of a sudden, we saw increase in the number of alcohol-related consults. And these for medications or psychotherapy. And a lot of the patients who saw us reported social isolation, being at home, work from home, stress of children being at home and also doing their education at home, and being segregated from the entire community as a human being. We are not meant to do that. And the one thing that went up was alcohol. They were also not worried about driving because they were at home. So that brought up the levels. And there are, in fact, a few studies that have come out which talk about alcohol levels and drinking going up during the pandemic times.
That's a really good point about the driving, because you think, well, I'm not driving, I'll have another glass of wine. So I can see how that would happen. I want to ask Dr. Pimentel, have you seen more people coming to you because of the pandemic?
I have seen them in a little bit of a different light. I see patients who have difficulty coping also, and some of it is their arrhythmias due to alcohol or just depression and things like that. I've also seen patients later in the course because they had avoided cardiologists early on because of the pandemic and such, and they end up coming to our office a little bit sicker than maybe what they typically would be if they weren't concerned about coming into the hospital or the office.
One of the things that's so fascinating about being able to do this show and talk to these experts is how much you learn. For example, Dr. Sethi, you were telling me about 3 different drugs that are FDA approved, correct?
Yes.
That can curb alcohol cravings that you can prescribe at the alcohol treatment, at the opioid treatment center, but which you also treat people for alcoholism. What are these drugs, and can you talk us through how they work?
There are 3 drugs that are FDA approved. The one that I want to really talk about first is naltrexone. This is one medication that actually sits on the opioid receptors and blocks it, but it curbs the release of dopamine from those receptors. And so when people drink, they don't feel the euphoria. So you can have a drink on top of that medication, but you will not feel that high or that sense of that, oh, I feel good.
Do you get any kind of unpleasant reaction, or it just takes away the reward of feeling that euphoria, that buzz?
It does take away the reward, and no, it does not cause any side effects if you drink on top of it. So it's a wonderful medication, and the better part is it comes in once a month injection as well. Which could be life-saving for a lot of people. So I'm going to give you an example. If somebody drinks every day, if I give him a medication, he will take it, and then maybe a few weeks down the lane, if there's a slip-up or something happened and started drinking back again, they'll probably stop the medication. However, if you have an injectable in the system, even if you drank, you can get up the next day and be functional and say, oh my God, I had this little episode, I need to get back on track. And the medication is helping you by preventing cravings. And when you drink on top of the medication, you are not going to feel that euphoria. So it's a great medication.
Do you find that more people are getting success from the medications or from the psychotherapy and talk therapy and counseling, where you're talking about your feelings and issues and things?
It's a combination. What medications will do for you is prevent you from always desiring, on thinking about alcohol and the desire to drink. So that part is taken care by the medications. And then if you bring in therapies of any sort, which focus on drinking and the way our brains work when we see alcohol or when we talk about drinking, and change those behaviors, the combination is really a good mix.
Do the other 2 FDA-approved medications work in the same way?
A little bit different. The other 2, one of them is called acamprosate. It also helps with the cravings. The only thing is you can start it once you have stopped drinking, which could be difficult to achieve in some patients. And then the third one, is the old one. It's called disulfiram, also known as antabuse. This is the one that if you drink on top of it, you can get sick. Now, potentially, there could be people who would really benefit from this medication, like say somebody in a healthcare setting or somebody who cannot afford to drink because they are on probation or some reason. And those are the candidates for that medication.
I'm getting a lot of community questions on this topic, so I want to get to those, particularly Dr. Pimentel, who I know you need to leave to see patients. So as soon as you need to peel off to do that, just give us a wave. And again, thank you for your time this morning. Dr. Pimentel, question from Gretchen. Gretchen wants to know, what does holiday heart feel like, and how do you know if you have it?
Well, holiday heart is typically it's a sensation of your heart racing irregularly and fast. It can be associated with some dizziness, some chest discomfort. You can feel kind of sick to your stomach. It's almost like a hangover, but with a lot of rapid heart rates.
Question for Dr. Sethi. I got an email from Anne who wants to know, if you're worried about someone's drinking habit, is there a phone number to call? Who do they contact? And I know that you gave us contact information for the addiction center here. So if we can put that up, we want to make sure that we get this information to everyone. It's the McNelly Addiction Treatment Center. The number they call is on the screen. Who answers, Dr. Sethi, when you call that number?
So it will typically ask you to leave a voicemail, and then within 24 to 48 hours, you will get a phone call back, and that will be just a screening questionnaire to see what is the need from the clinic. And if you talk about alcohol, then you will be placed with one of the doctors for an initial consultation. And then once you see me or another doctor there, you would probably then be referred to psychotherapy in, or if you want to do it outside, we could give you resources as well.
And that would also fall, once they're referred and they're hooked up with you, those medications you're talking about could also be an option.
Yes, of
which
course.
is
Of course.
such a great resource. Question for Dr. Porter from Jane. Jane wants to know, Dr. Porter, if it's true that 1 glass of wine a night is good for your heart. And Dr. Porter, you and I have talked about this. We always hear a different thing in the news every day. Is a glass of wine a night okay for your heart?
This is fascinating. And the first time I heard about this, I think it was in 1991 on a 60 Minutes, the French paradox, where they were talking about French people eat, they don't exercise, they're chugging down all these fats, and they don't have as many heart attacks. Well, it turns out that continues to be true in studies from around the world. But what is now been shown in a magnificent study from a couple of years ago, those benefits for ischemic heart disease, which is heart attacks and chest pain, do not tend to accrue until you're in your 60s. And the study showed that even up into people in their age 95 continue to have fewer heart attacks at about 1 or maybe 2 drinks a day max. But they also look at health from age 15 to 95, and disorders, damage, loss of life years from disability start to accrue at age 15 to 20, including atrial fibrillation, car wrecks, interpersonal violence. So there's a lot of things, multiple kinds of cancer. Breast cancer increases very early in alcohol intake, almost with 1 or 2 drinks a day, less than the threshold. So yes, it is heart attacks, ischemic heart disease, but not heart failure, not hypertension. There are a lot of other things that show up earlier, and this heart attack stuff is true, but it's really only benefiting people who are 65 and up. Before then, it's a hazard, and the benefit is slight relative to all the other cancer and liver disease related things that show up sooner. So it's a slight benefit, but there's a lot of hazards about alcohol above a glass or 2 a day. And the other thing about the glass of alcohol is wine now in this country, if you look at the label, it's commonly 14 or 15% alcohol.
Right.
These standard alcohol units are presuming it's 12% alcohol. So we're in, you need to round down. And, if you're thinking about, it's okay, you don't have to, you may have to eat all your vegetables before you figure you can give yourself dessert, but you don't need to finish that little last bit of wine. Leave it on the table.
Alexis, can I just piggyback back on that just a little bit? Just to basically say that there's actually been studies. So the moment you take the glass of alcohol, you ingest it, your risk of atrial fibrillation increases like within hours. And
is this for anyone? Like a regular person watching?
This is for anyone. But the these benefits that Charlie is talking about, and really the mechanism of the benefit is, we think it's because it makes your platelets a little bit more sticky, and so you can't clot so much in your heart arteries and give you a heart attack and stuff. Those benefits actually don't come about from alcohol until a week later. So very early on, you have a high risk of AFib, and then that risk comes down, and then you have the beneficial effects for coronary artery disease with alcohol.
So if you go into AFib...
Dr. Pimentel's way too young to get the benefit of the heart attack.
Dr. Porter knows how to flatter us, right?
That's right. That's right.
I'm getting a lot of questions, doctors, and they're all along the same vein here. About 4 different people have asked me in different ways if there is a type of alcohol that's less bad for your heart than others, and if they don't want to avoid drinking altogether, what beverage should they choose? Is there a less toxic version of any alcohol? I'll start with Dr. Pimentel.
Thanks, because I have to run, but I would say no. I think, really all these studies look at a certain number of grams of alcohol, and as mentioned earlier, 12 ounces of beer equals 5 ounces of wine equals 1.5 ounces of a spirit. So there's really no better drink than others. I know there's been some studies looking at red wine versus, other things, and there's some small studies looking at beer, but there's nothing that's ever been, and Charlie, you can correct me if I'm wrong, but I don't think there's any big studies that have ever said that we should all be drinking red wine instead of beer. Thanks, guys. See you later.
Dr. Pimentel, thank you. Thank you again for your time. We know our doctors have very busy jobs going to actually tend to patients, so that you took the time out of your day to join us on All Things Heart. We appreciate it. Thank you, Dr. Pimentel. I have Dr. Porter, did you want to weigh in on that? You were starting to say something.
No, I think it's just, it's alcohol is the alcohol, and this
Right.
has been looked at around the world. And the alcohol, these amounts of alcohol show up as threats or hazards, regardless of how you're taking it. Regardless, it doesn't matter. It's just it's the alcohol, percent alcohol.
I have a question. I have a question on Facebook from Gretchen Kennedy Helgeson. Gretchen wants to know, and Dr. Sethi, maybe you could answer this. Does Wellbutrin block the desire to drink?
It's an off-label medication that people have tried. It is used more for nicotine cessation rather than alcohol specifically.
So it has been used to stop smoking?
Yes.
Okay.
And we do it all the time in our clinic. But for alcohol, off-label, we mostly use gabapentin, topiramate. Those are the medications that we use more, less of Wellbutrin for alcohol itself.
And gabapentin's also a painkiller, right?
Yes.
Something with your nerves?
It's used for neuropathy, and it is used in people who are diabetic. It has got some value in even the opioid management itself, but we use it for alcohol cravings, and it works pretty good with combination with other medications.
Dr. Porter, Angela wants to know, what do you do if you experience symptoms of holiday heart? In that moment, what do you do?
If you can count your pulse, if you're worried about it, and I have a lot of people who come in with rapid heartbeats, we put a monitor on, and we find out that when their heart is rapid, it's actually only going like 90 beats per minute. And so there's some issues about anxiety, but if you have if you have some way to count your heart rate, if you feel this in the middle of the night, have you got your watch and the light on to count your pulse? But I've just been surprised sometimes in my own life, if I feel my heart checking in my pounding, sometimes I'll just check my pulse and it's 80. I just decide, I've got something wrong, it's my turn, and then it turns out it's 80. It's slower than I thought it was when I counted. So I think the first thing to do is count your pulse just at the wrist, or it's probably the easiest place. There's a bone, or there's a big bone that sticks out by your thumb, and you can slide your finger over the little groove there, and that's where your pulse is. Just kind of place your fingers gently there, and count for 15 seconds, and multiply times 4. But I think it would be good for you to get, and Garmin's a Kansas City industry. Get a Garmin watch. There's other companies around, but if you have a lot of people have watches that'll count your pulse or give you a rhythm strip. So, if you think this is happening, I get a lot of help from people showing me their watches and their heart rhythm on their watch.
Right. We actually have an episode coming up on how people have detected their heart problems from wearing their smart watches. That's in a few weeks from now. I've got a question from Leah. Leah wants to know, does this short bout of AFib have the potential to cause long-term damage to the heart? Dr. Porter?
Well, short burst, no, it just depends. And this is one of the things that you're not sure of. If you think you've had that, it's really hard to know how much you have. And the biggest risk for atrial fibrillation is stroke. And a 40-year-old person in perfect health is not at much risk. But when, one of the presents you get when you turn 65 is an extra point for risk at 65. High blood pressure, diabetes, coronary disease, previous heart failure, all those things increase your risk of stroke. 30 seconds of AFib won't do that, but the AFib burden makes a big difference, along with your other personal characteristics about risk of stroke. That's the most tragic thing about strokes. That's the most tragic thing about atrial fib. Some people come into the emergency room with a stroke, they had atrial fib they didn't even feel and find out the atrial fib was the culprit, and they don't. So it's important if you think you're having an atrial fib is irregularly irregular. It's kind of like you're playing, your heart plays a drum beat, but the drummer has had too much to drink and the rhythm is very irregular.
Oh, interesting.
That's a hallmark of atrial fib, and much more significant than something that's just very like a metronome, very steadily rapid at 120. Neither one of them are normal. But the atrial fib and the burden, but if you think you've had these episodes of irregular heart rhythm, that you just need to figure it out. If it's momentary, probably nothing, but if you notice it in a sustained manner, and sometimes it persists, triggered by the alcohol, but sustained once it gets set up. So look into it if it's anything other than transient.
We have a question. Someone emailed us wanting to know, and I'll keep their name off of this one. If you woke up this morning and you're white knuckling it, what tips do you have to make it through a day of temptation? And this is for Dr. Sethi. What do you tell people?
Well, if first of all get evaluated to see if you have developed alcohol use disorder, as we call it. If it is, then there are medications you can get on. If you think you're still not there, you could start with therapy. You could have a sponsor out in the community. You could go to a AA meeting. But to take care of your cravings, you probably need a med and then therapy of some sort that could help you not drink. Realizing the fact that you might have genetic composition and environmental factors that would make you drink. And if you do have those, your chances of getting an addiction or a problem with alcohol is higher than the general population.
Do you advise people who are starting to feel like they're struggling to stay away from social events? How do you navigate still being able to be with your friends and be social on a holiday like St. Paddy's Day or spring break, but not put yourself in a position to fail? What do you tell people?
I've always told our patients to be honest. If you think you have developed a problem or are developing a problem with alcohol, you can be honest to family and friends and say, I think this is a problem for me. I will not drink. You can drink in front of me, or you can decide not to drink with me. And I think there will be some change in friends. So as we talk about people, places, and things, there will be some change of people who might not be your friends, but that's okay, because ultimately it's about you getting better.
And if someone doesn't want to be your friend because you're trying to get through an addiction, that's not much of a friend.
Yes, absolutely.
I have a medical question for Dr. Porter. Dr. Porter, Gretchen wants to know, this is about a specific drug. So Gretchen writes, my daughter takes Topamax. Is she at a huge risk of any sort if she drinks? She's underage right now, but approaching that college age, and I'm a little worried about her being on that drug, but she does need it. Are you familiar with Topamax? I'm not familiar with that drug.
I'm not. I'm familiar with Topamax, but I think it's not in anything where it's fundamentally a problem in association with alcohol. So I think you would need, the prescribing physician, that's a prescription drug, and I think the prescribing physician is the one who should be best capable of knowing what drugs or what environmental circumstances. Topamax doesn't play well in the sandbox with other chemicals, but it's
a good way to put it.
That's not something we as cardiologists are familiar with. Oh, here's another person on Topamax with AFib after they had a drink.
Got it.
Can I add a point here?
Absolutely.
Topamax is another name for topiramate that I mentioned, and we use it off-label all the time for our patients. Of course, we want to make check, they're not developing any problems related to topiramate.
Is it, you use it to treat something in the addiction center?
For alcohol.
It's one of the big three that we talked about?
No, it's an off-label medication, but we will have patients that we will put them on topiramate for cravings and with another medication, or just on topiramate, and some of them do well.
So for someone like Gretchen who just wrote in, that drug Topamax is sometimes used to treat people for alcohol addiction?
For the dealing with the cravings for alcohol
So it might
addiction.
take away the craving when her daughter enters college or gets to that age. That's super interesting. But again, probably also best that Gretchen talk to her daughter's doctor as well, but
Absolutely.
I'm so glad that you added that. We do want to get Dr.
One
Porter.
other thing, there's a lot of talk about FDA approved and not FDA approved, and particularly with the vaccinations. FDA approval costs millions of dollars for a drug company to do, and it's only obtained when a drug is early in its life cycle, when a company can justify spending millions of dollars or to get it on the market to get FDA approval. Drugs, after they're in a certain part of their life cycle, the drug company won't spend the money because it's going to be generic soon. Many drugs have excellent studies showing they are highly valuable in certain situations. The research has been done, but they haven't gone to the FDA and sit there and be grilled by the FDA panel about why they should give their approval. So, physician experts can use drugs. I tell people that's not FDA approved, just so they know, particularly with all the awareness of FDA approval. But a physician with expertise and confidence, there are research studies that show this is good and safe. It's the right drug for you. It'll never be FDA approved.
I want to give Dr. Sethi one last opportunity to talk about, again, that phone number that we showed earlier. In case you missed it, it's for the McNally Addiction Treatment Center. If we can put that information up again, we can't share this enough. Everybody's struggling, as Dr. Sethi was talking about. It's become so much more addiction, more prevalent now than ever. So that number is 913-588-6493 if you are just going through it right now or you know someone who needs help. I want to get our final thoughts on this. Dr. Porter, as you think about holiday heart and drinking, and as we enter this precarious season of St. Paddy's Day and spring break, what are your final thoughts?
Well, I think alcohol probably has more problems associated with it health-wise, but people have to make their own decisions. I think the idea, and I told you, the idea that alcohol is heart healthy for you, it's kind of like, I was thinking about how to explain this, since we just finished the Olympics. It's like curling, and you've got a little target at the end of the ice that says heart healthy. Well, it's a small target, and you slide that stone down toward heart healthy. Well, if you miss it, you're on a lot of unhealthy categories, or maybe there's a little overlap, even if you're drinking that little bit of wine that may help you avoid a heart attack. If you're in that age group, you're at risk for some other things as well. So I think the answer is, if you're ever thinking about whether it'd be a good idea to have one more glass of wine when you've already had one, I think just drink your favorite beverage, sip it slowly, and get a lot of mileage out of that first glass, and try to know when to put your hand over the glass at a restaurant when they'll fill it when you're turned away. Be cautious about that.
Dr. Sethi, what about you?
I totally agree with this. I think this is all mindfulness, and if people are mindful about how much they're drinking, they could stop at that point, because they can remind themselves, do I need more? Is it going to help me? It's probably going to make it worse from here. And I think just drinking it slowly probably, and limiting the amount that they're drinking, would really help them in the long run.
This discussion has been awesome. Dr. Sethi, thank you for making time to drive in during a snowstorm and see us. Thank you, Dr. Porter, for making time, joining us virtually. We really appreciate it. And Dr. Pimentel, who had to go see patients early. Boy, thank you, Dr. Pimentel, for weaving us into your busy schedule between seeing patients and helping us reach the public about this. And I have a final thought. As you drive around the metro area today, keep your eyes peeled for some beautiful heart work. More than 150 giant hearts, all decorated by artists and people across the metro, are on display. Some of them were decorated and designed by our teammates here at the University of Kansas Health System. In fact, we're showing you some video right now of these beautiful creations that have been put up all around the hospital campus. You can find these hearts across the metro starting now. The Parade of Hearts features all sorts of themes, including the Jazz District, Kansas City Barbecue, healthcare workers on the COVID-19 pandemic front lines. Jen Nussbeck works with Hope House, and Jen is co-chair of the Parade of Hearts.
Having 14 sponsored hearts throughout the region, and really kind of leading in the sense of, you guys have such a will and a heart forward. Your healthcare workers are our heroes, and there is a heart that really represents that superhero. From the bottom of our hearts, thank you for supporting and being a part of this endeavor.
Super cool. And if you want to check out all the different hearts across the metro, they're going to be on display over the next few months. So you can download an app that the organizers have launched, and it includes incentives for when you visit certain locations. That'd be a fun thing to do with your kids. And then this is even better. The hearts are going to be auctioned off to the public in June, and some of that money is going back right here to the cardiothoracic programs here at the University of Kansas Health System, which will be wonderful. And as we leave you today, there have really been some amazing studies in heart disease, but there's something big missing. We don't know enough about women's hearts.
It's predominantly done in men. Like 3 of the 4 people that we put into studies that lead to helping us better understand and do a better job of managing heart disease are done on men. And so our first step to understand heart disease better in women and do a better job of treating it is to first know if there, when you talk about, we don't specifically know a lot of the differences between men and women, or we don't always apply medical therapy as well to women as we do to men. One, because we just don't have the research to back it up, or that motivates us, or we feel confident to make that decision in women the same as we do in men.
That was one of our amazing cardiologists, Dr. Shannon Hoos Thompson. She is incredible. And speaking of doctors, March 30th is National Doctors Day. So to celebrate and honor our doctors, we would love you to help us do that. We have a super cool way that you and your family can send a thank you. On your screen right now, there's a QR code. It will automatically do all the work for you. You fill in all the necessary information to get a video. You just shoot the video. Send it to us, follow the instructions and the notes of the email. Once we get your video, we will put it on the air. So we will air your special message thanking our doctors. We can't wait to see those videos. Thank you so much for being with us today. And next week on All Things Heart, Terry Allen was at the top of her profession. Fitness instructor, personal trainer, nutritionist. Then she got COVID.
I want people to know that, COVID, it doesn't have a look. It gets healthy people. It gets Black, white, Hispanic, and anyone.
It has been 2 years and she still struggles some days to even get out of bed with unexpected heart problems from COVID. They're stopping her from following her dreams. Terry is also working to fight vaccine hesitancy. Join Terry with us and our doctors next Thursday morning at 10. Be sure to bring your questions. We will see you on All Things Heart then.